Smoking is a global epidemic, affecting millions worldwide. Nicotine, a highly addictive substance found in cigarettes, hooks smokers into a dangerous cycle. This makes quitting extremely difficult, even when faced with severe health consequences. The allure of smoking often begins in youth, highlighting the importance of early intervention and education. Despite widespread awareness about the dangers of smoking, many people still fall victim to this deadly habit. The short-term effects of smoking, like bad breath and coughing, might seem minor. However, they are early indicators of the serious damage happening inside the body. Your body sends out warning signals when you smoke, even if you don't notice them right away. These signals are your body's way of telling you that something is wrong. Smoking introduces a host of harmful chemicals into your system, and your body tries to fight back. But often these early signs are subtle and easy to overlook. It's important to pay attention to what your body is telling you. Coughing, wheezing, and shortness of breath are common early signs. These symptoms might start off mild, but they can quickly become more severe. Coughing is your body's way of trying to clear out the irritants from your lungs. Wheezing indicates that your airways are becoming constricted, making it harder to breathe. Shortness of breath can be a sign that your lungs are not able to take in enough oxygen. These symptoms indicate that your lungs are struggling to function properly. When you smoke, the delicate tissues in your lungs become inflamed and damaged. Over time, this can lead to chronic obstructive pulmonary disease, COPD, or even lung cancer. Medical imaging can reveal the extent of the damage, showing areas of inflammation and reduced lung capacity. It's a clear sign that your respiratory system is under stress. Ignoring these early warning signs can lead to more serious health problems down the road. Many people dismiss these symptoms, thinking they are just a normal part of smoking, but this mindset can be dangerous. By ignoring the signs, you allow the damage to continue unchecked. This can lead to more severe respiratory issues, heart disease, and other serious health conditions. It's crucial to take these early signs seriously and seek medical advice. Smokers often dismiss these symptoms as smoker's cough or a minor inconvenience. They might think that a persistent cough is just something they have to live with, but this is a dangerous misconception. A persistent cough can be a sign of chronic bronchitis, a condition that can lead to more serious lung diseases. It's important to recognize that these symptoms are not normal and should not be ignored. However, these signs indicate that the toxins in cigarette smoke are already harming your respiratory system. Each puff of a cigarette introduces thousands of harmful chemicals into your lungs. These toxins can cause immediate damage, leading to inflammation and reduced lung function. Over time, the damage accumulates, making it harder for your lungs to heal. The warning labels on cigarette packs are there for a reason. They highlight the serious risks associated with smoking. It's crucial to recognize these early warning signs and take action to quit smoking before the damage becomes irreversible. Quitting smoking is the best thing you can do for your health. It can be challenging, but the benefits are worth it. Your body has an incredible ability to heal itself, and many of the harmful effects of smoking can be reversed over time. By quitting, you can improve your lung function, reduce your risk of serious diseases, and lead a healthier, longer life. That persistent cough, often attributed to smoking, is not harmless. It's a signal from your body, a distress call that something is wrong. Many people dismiss it as just a smoker's cough, but it's much more than that. It's your body's way of trying to expel the irritants and toxins inhaled with each puff. When you inhale cigarette smoke, you're not just taking in nicotine, you're also inhaling a cocktail of harmful chemicals, including tar, carbon monoxide, and formaldehyde. These substances coat your lungs and airways, causing immediate and long-term damage. It's your body's way of trying to expel the irritants and toxins inhaled with each puff. Over time, this constant irritation can cause inflammation and damage to the delicate tissues in your airways. The inflammation leads to swelling and narrowing of the airways, making it harder to breathe. This is why smokers often feel short of breath and have difficulty performing physical activities. The damage doesn't stop there. It can also lead to chronic bronchitis, a condition characterized by a persistent mucus-producing cough. This damage makes it harder for your lungs to clear out mucus and fight off infections, making you more susceptible to bronchitis and pneumonia. In severe cases, the damage can lead to the development of emphysema, where the air sacs in the lungs are destroyed, reducing the surface area available for gas exchange. This makes it incredibly difficult to breathe and can severely impact your quality of life. The longer you smoke, the more damage accumulates and the cough worsens. What starts as a mild irritation can quickly escalate into a severe health issue. The persistent cough is not just an annoyance, it's a sign that your lungs are struggling to cope with the constant assault of harmful substances. Over time, this can lead to irreversible damage and chronic respiratory conditions. It's a vicious cycle that can eventually lead to chronic obstructive pulmonary disease, a debilitating and potentially fatal lung condition. COPD is characterized by a progressive decline in lung function, making it increasingly difficult to breathe. Patients with COPD often require long-term oxygen therapy and may experience frequent hospitalizations due to exacerbations. The impact on daily life is profound, affecting everything from physical activity to social interactions. It's a stark reminder of the severe consequences of smoking and the importance of taking steps to quit. Smoking is the primary cause of lung cancer, a disease that claims millions of lives each year. Cigarette smoke contains over 7,000 chemicals, many of which are carcinogenic, meaning they can cause cancer. These harmful chemicals damage the DNA in lung cells, leading to uncontrolled cell growth and tumor formation. The damage to the lungs from smoking goes beyond cancer. Emphysema, another serious lung disease, destroys the air sacs in the lungs, making it difficult to breathe. Chronic bronchitis, characterized by inflammation and mucus buildup in the airways, further restricts airflow and makes breathing a constant struggle. Section 5. Beyond the lungs, smoking's devastating reach. The harmful effects of smoking extend far beyond the lungs, impacting nearly every organ in the body. Smoking constricts blood vessels, reducing blood flow and increasing the risk of heart attack and stroke. It damages blood vessels and increases blood clotting, further elevating cardiovascular risks. Smoking also weakens the immune system, making smokers more susceptible to infections and slower to heal from injuries. It increases the risk of various cancers, including bladder, pancreas, and kidney cancer. Furthermore, smoking has been linked to vision problems, dental issues, and osteoporosis. Section 6. The silent killer. Smoking and heart disease. Smoking is a major risk factor for heart disease, the leading cause of death worldwide. Every year, millions of people succumb to heart-related illnesses, many of which could have been prevented by avoiding smoking. The statistics are staggering, with heart disease accounting for nearly 1/3 of all deaths globally. This silent killer affects people of all ages, genders, and backgrounds, making it a universal health concern. Nicotine, the addictive substance in cigarettes, raises blood pressure and heart rate, putting extra stress on the cardiovascular system. This increased strain can lead to hypertension, a condition that significantly heightens the risk of heart disease. Smokers often experience a rapid heartbeat and elevated blood pressure, which over time can cause severe damage to the heart and blood vessels. Carbon monoxide, another harmful chemical in cigarette smoke, displaces oxygen in the blood, forcing the heart to work harder to deliver oxygen to the body's tissues. This lack of oxygen can lead to shortness of breath, fatigue, and in severe cases, heart failure. The presence of carbon monoxide in the bloodstream reduces the amount of oxygen that can be transported to vital organs, further exacerbating the risk of cardiovascular diseases. Over time, smoking damages the lining of blood vessels, making them more susceptible to plaque buildup. This buildup, known as atherosclerosis, narrows the arteries and restricts blood flow. The reduced blood flow can lead to chest pain, also known as angina, and if left untreated, can result in a heart attack. The damage to the blood vessels is often irreversible, making prevention through smoking cessation crucial. This buildup narrows the arteries, restricting blood flow and increasing the risk of heart attack and stroke. When the arteries become too narrow, they can no longer supply sufficient blood to the heart and brain, leading to life-threatening conditions. The risk of heart attack and stroke is significantly higher in smokers compared to non-smokers, highlighting the importance of quitting smoking to improve cardiovascular health. Even exposure to secondhand smoke can increase the risk of heart disease in non-smokers. Secondhand smoke contains many of the same harmful chemicals as directly inhaled smoke, posing a significant health risk to those around smokers. Children and adults exposed to secondhand smoke are at a higher risk of developing heart disease, making it essential to create smoke-free environments to protect public health. The impact of smoking extends beyond the smoker, affecting families, friends, and communities. Section 7. Secondhand smoke, a hidden danger. Secondhand smoke, the smoke exhaled by smokers and the smoke emitted from burning cigarettes, is a serious health hazard. It contains many of the same harmful chemicals as directly inhaled smoke, putting non-smokers at risk for many of the same health problems. Children are especially vulnerable to the effects of secondhand smoke. Exposure can lead to asthma, ear infections, respiratory illnesses, and even sudden infant death syndrome, or SIDS. Pregnant women exposed to second-hand smoke have a higher risk of premature birth, low birth weight, and other complications. Section 8. Breaking free. Your journey to a smoke-free life. Quitting smoking is the single most important step you can take to improve your health. While it can be challenging, it is possible to quit for good. There are many resources available to help you quit, including counseling, medication, and support groups. The benefits of quitting smoking begin immediately. Your heart rate and blood pressure drop within 20 minutes of your last cigarette. Your risk of heart attack starts to decrease within 24 hours. Your lungs begin to heal within weeks to months. Section 9. A breath of fresh air. Reclaiming your health. Quitting smoking is a journey, not a destination. It's about reclaiming your health, adding years to your life, and improving your quality of life. It's about setting a positive example for your loved ones and inspiring others to live healthier lives. Every day without a cigarette is a victory. Celebrate your successes, learn from your setbacks, and never give up on your goal of living a smoke-free life.